This episode of Doc Talk is brought to you by First Bank. We're not just your neighborhood bank, we're your neighbors. Our local team lives up to the name, putting our customers and community first. To experience First Bank difference, stop by any of our 13 Knoxville area locations or visit firstbankonline.com. First Bank, member FDIC.
Hello, my name is Dr. Rob Page and welcome to Doc Talk. Doc Talk is a podcast that's produced by the Knoxville Academy of Medicine and features its physician members giving information to patients to better their healthcare lives. And in saying that, I have with me today Dr. Kyle Kleppe. Dr. Kleppe is a general surgeon here in Knoxville who specializes in what areas?
Minimally invasive surgery, so quick recovery, small cuts, and I also do bariatric surgery, surgical endoscopy, and hernia surgery.
So principally GI or stomach type operations. So, and in saying that, we're going to talk about something that unfortunately affects a lot of people in the United States, and that is gallbladder disease. So what can you tell us about the gallbladder? What does it do? Why do we need it? And what do we do with it when it goes bad?
Sure. So the gallbladder normally aids in our digestion, and it stores bile, which is basically like a soap that our body makes to help digest fats and absorb all of the nutrients effectively. The liver makes bile and makes it continuously, but we don't eat continuously, so the gallbladder serves as a reservoir, similar to our urinary bladder would serve to store our urine so that we don't have to go to the bathroom all the time.
Right. So unfortunately, the gallbladder can become diseased and become problematic. What are some of the factors that lead to people getting gallbladder disease?
Yep. I think the biggest thing is our Western diet. We eat a lot of fatty foods, and that leads to overproduction of cholesterol by our body, and that is excreted by the liver, and that can form stones in the gallbladder. And so when that level gets too high, it precipitates out and forms some sludge, and that sludge can get compacted down into a stone.
So when we have these stones, are stones automatically symptomatic? Are we going to have problems if we have a stone? Are we going to notice it all the time? Or what sort of problems would patients have if they do have these stones?
Sure. Many people actually have gallstones and they don't bother them at all. And that's what we call an incidental finding. So you may be going to the doctor for something else and get a CT scan or an ultrasound, and they may comment that you have gallstones. And those type of people don't need anything to be done about their gallstones. If they are not bothersome, and we don't really know if they're going to become bothersome in the future either. When gallstones do become a problem, the symptoms that these patients get is typically right upper quadrant pain, or pain in the upper abdomen just underneath the rib cage. And they typically get these pains after eating a meal that may have a higher fat content. And the gallbladder is just trying to work, but it's meeting some obstruction and crunching on those stones a little bit, and that can cause pain.
Any other type symptoms, maybe some unusual symptoms that might be related to gallbladder disease? Or
Sure. So that was just the typical symptom, what most people may complain about, but sometimes it can be more heartburn type symptoms, or chest pain, or even the pain can radiate or come around the back and present with symptoms that way.
So a variety of different symptoms, but the common factor in all those being typically after we've eaten a meal, perhaps gone to Cracker Barrel and had the chicken fried turkey or whatever it is with
Sounds
gravy.
delicious.
I just saw it on a commercial about it here recently. So I come to. So what is the initial evaluation for a patient like that? I think I might have gallstones. I have the classic sort of pains. What sort of studies are done on these patients?
Sure. So I think the most important thing is always to be evaluated by your primary care provider. And the first test that they are likely to order is an ultrasound of the gallbladder itself. And then they're able to identify whether or not you do have stones. And if your story kind of fits all the things that we talk about that can usually be attributed to gallstones, and then you do have those findings, then that typically is where you would get a referral to a surgeon.
Gotcha. Well, let's say I'm the type person who doesn't necessarily want to go visit the surgeon. I can live with the pain. I may try to alter my diet slightly. What are some of the risks of us not approaching this and actually getting it taken care of?
Right. Well, gallstones, unfortunately, are not going to go away over time. And once somebody becomes symptomatic with their gallstones, it is likely to continue on in the future, despite some of these more common initial attempts at trying to work around these symptoms. Really, what can ultimately happen is these gallstones can block off the duct to the gallbladder, and you can develop a condition called acute cholecystitis, and that's where you have this pain which may become more severe and is unrelenting, and you can get a fever, and most of these people show up in the emergency department and get an emergency operation.
So that would be like an infection of the gallbladder, something similar
Right.
to, you'd have like an acute appendicitis, to be like an acute cholecystitis.
Acute cholecystitis.
And if we have acute cholecystitis, don't end up in the emergency room. That becomes a serious problem, does it not?
Well, and I think the biggest thing is that it's an unpredictable event, and you could be doing anything. You could be traveling or at a major life event and have that problem. So I think if people are aware that they have this problem and it's becoming more bothersome, then I think it's something to investigate about getting the gallbladder out.
Gotcha. So let's say that I've decided to come to you for a surgical consultation. What sort of evaluation would I get from you prior to surgery, and what sort of things should I expect getting in the surgical procedure? Is it a large scar? I mean, is there some, as a patient coming to you, what are some of the expectations that I should have coming into your office?
Sure. So fortunately, some of the workup has already been done, usually with that ultrasound. We're going to perform a detailed history with you. I'll perform a physical examination, make sure that you're a suitable candidate for surgery and anesthesia as well. Once we get that all arranged, then we can get set up for surgery. The surgery that's offered is generally a minimally invasive type operation, either using laparoscopy or an additional form of laparoscopy called robotic surgery. And both of these surgical procedures usually involve about 4 small cuts on the abdomen where we can go in with a camera and small instruments and take out the gallbladder that way. It's an outpatient procedure under general anesthesia all the way off to sleep. You don't remember anything. It says outpatient, so you come in, go home the same day. The recovery is generally pretty good. I use some long-acting numbing medications that really help with postoperative discomfort. Many of my patients don't require any type of narcotic medications afterwards, so they can take over-the-counter medications such as Tylenol or ibuprofen to help with the recovery. I generally don't limit my patients on what they eat afterwards, and a lot of people are feeling a lot better and want to resume their normal diets that they've been missing out on for a while. And then from a recovery standpoint, I would say many people are out less than a week from work unless you have a heavy labor type job.
Wow. So something that can be taken care of in a fairly rapid. Now, is this you mentioned it's an outpatient surgery, so you're coming in the morning, you're at home by that evening. And typically from the job, you would, maybe schedule a few days off to a week off to make sure you have adequate recovery. Is this something that insurance would pay for?
You bet.
Okay.
Yeah, this is a very common procedure that's offered. It's one of the most common operations that I perform. Yes, if you are meeting all of those criteria, then you shouldn't have any problems with your insurance provider.
Now even something with robotics, and what interests me about robotics is what sort of situation would you use robotics as opposed to just sort of more of the traditional endoscopic surgeries?
Sure. Sometimes when I utilize robotics, it is on people that have had multiple abdominal operations previously. I'm able to place my incisions in different locations that can help optimize their recovery. So, for instance, today I did 2 gallbladder surgeries, just like we mentioned, and they've had previous hernia repairs on their abdomen. So the traditional locations to place our incisions is altered, and robotics can make it a lot easier on the surgeon. And then additionally, patients that may weigh more, robotics can make a gallbladder easier for all of us.
Now, how do the robotics work? Is this something that it's automated by itself, or is this something that you control, or because something that's always fascinated me about the concept of robotic surgery and how the surgeon plays into all this. How does that work? How do you operate that sort of surgical equipment?
Yep. So the robot is not autonomous yet. So it still involves, it requires us to do all of the motions. We will connect the robot to the patient through the same type of small instruments that we would with laparoscopy, and then instead of the surgeon being immediately at the bedside with the hands on the instrument, the robot is controlling the instrument, and I as the surgeon will sit at a separate console that has video monitors and some joysticks basically to perform the surgery.
So it's almost like video game surgery.
That's right.
So we've talked about gallbladder disease today. Talk about an excellent way to approach it, which is the classic way to approach it, because gallbladder disease is not something. It's not like a kidney stone that we're just going to pass the stone and end up getting better afterwards. This is something that we really need to deal with if we start having those symptoms. Now, Dr. Kleppe, can you tell us where your office is located and how we can contact you if we have any of these symptoms or we'd like to get additional consultation about possible gallbladder disease?
Sure. So my office is located at the University of Tennessee Medical Center on Alcoa Highway in Knoxville. And you can call our office at 865-305-9620 or visit our website at utsurgery.com. Or if you waited too late, you can also come see me in the ER.
but not optimally. That's not what you want to do.
Not what you
want to do. Well, Dr. Kleppe, thanks you so much for joining me here today.
All right.
And with that brings this episode of Doc Talk to a close. Doc Talk is a podcast that is produced by the Knoxville Academy of Medicine and features its physician members giving information to patients to better their healthcare lives. I'm Dr. Rob Page, and thank you so much for joining me here today.
This episode of Doc Talk is brought to you by First Bank. We're not just your neighborhood bank, we're your neighbors. Our local team lives up to the name, putting our customers and community first. To experience First Bank difference, stop by any of our 13 Knoxville area locations or visit firstbankonline.com. First Bank, member FDIC.